All right, so we're back here again. We're going to finish up, or as much as we can, for empirical with criteria for a theory. So we left off with clarity and precision, and so we'll also look at this one is possibly the most important, is empirical validity. So when we think about empirical validity, like what exactly are we talking about here? So first point that we have here is that this is what evidence is there to support a theory or an explanation. So I said support a theory, and it says Siri, and I said no, that's not what I want. So excuse that, that's my phone. So support a theory or explanation for a phenomenon. So the important thing to keep in mind, right, is that this is always in flux and it's subject to change, which I'm representing delta, right? So the point of this, right, is that there are always new studies that evaluate a theory, and because of that, right, there's always changing bodies of evidence. And so because of that, because we're interested in these new studies and we're always changing bodies of evidence, right, it's a constant assessment of an explanation. And so what ends up happening in the situation is that when we focus on this constant assessment of an explanation, right, we want theories with a lot of evidence. Because if there is positive evidence, theory is good. So that means that it is a good theory. We have a lot of evidence that supports this argument. We can believe that there are some mechanisms in place that support it. If a theory is negative, then there is not a lot of evidence. And means that theory doesn't work. The other part to consider is that because of this, right, is that there is no evidence one way or the other. This doesn't mean a theory is bad. So it could just be if there's no evidence, like because people aren't testing it, maybe it's not popular. Maybe it's not popular, or alternatively, it could be very unclear or complex, so it's not simple, or perhaps not testable. So as you can kind of see, right, all these are sort of like interrelated points. And that, what do we do from the situation, right? So if we have no evidence, it doesn't mean the theory is bad, or it's not popular, or it's unclear, it's complex, and it's not testable. Then there's like a lack of empirical validity, which means we can't buy it as an explanation, right? So keep this like kind of in the back of your mind when we go through and start talking about this kind of material, because if something has mixed evidence, like it suggests the theories may be unclear or that it needs refinement. If it's positive, it suggests that one aspect is good or that the theory is supported. If there's a lot of negative evidence, so a lot of evidence that doesn't say a theory works, then we probably don't think it's true, right? So all these things are keep in mind, and you should ask yourself this we need to consider an explanation, right? That regardless of the explanation, whether it's clarity, whether it's clear, whether it's simple or testable or whatever, if there's no evidence to support it, then it's really not useful, right? So we shouldn't maybe believe it. The other part to consider, right, in the sort of explanation, right, are the usefulness and policy implications of a theory, right? So basically, let's say we accept an explanation theory as true. So let's say we do that, right? What do we do about it? So, basically if we have a body of evidence, right? And we say okay, so the theory says that a behavior, and so we go back to our first one, right, is if we think that drinking has this pathway to yelling. So let's assume that's true for a moment then, right? So the big question then is, what do, not necessarily those words, right, but what do we do about it? Under this theory, right, we would want to quit drinking, and hopefully this equals no yelling. And if that's the case, that's good. Now, it may be, what do we do about the quit drinking part, right? Well, that could be more complex, right? So, maybe this is abstain. Maybe it's more of a restrictive thing, so we limit the amount. Or maybe we ban alcohol. Or, who knows what, right? Ban alcohol, we could maybe educate about harms from drinking. So the point being in this, right, is that based off of this idea that drinking leads to yelling, right, and if we want the yelling to stop, we maybe need to quit it. We have these different implications, right, of all these different things that we can do, because we can abstain from drinking. We can maybe limit the amount that we have, so moderation. We could ban it outright to limit yelling in general. We could educate people about these things. Or, we could also seek treatment or rehab for people who are addicted and can't stop, right? So because of this explanation, right, what leads to yelling, right, there's there's measurable impacts of things that we can do. So we're looking for direct, measurable things to do to change policy. So that part is good then, and so because of that, it's a useful explanation so there's some utility we can have from the theory, other than being well, I guess there's nothing we can do, right? Because that's not really helpful in and of itself. So yeah, so we'll use this to kind of wrap up here, and hopefully this kind of help make sense, help clarify it. And so in the next video we'll talk about, for example, with Dr. Now and his fatty 600-pound life patients, right? So I'll see